Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in this week's episode I want to answer a question from Katrina, who is one of our clients. So Katrina has her son in intensive care on ECMO, and I read out what Katrina wrote in her last email to me. So Katrina says, it's been 6 weeks now since my 36-year-old son was admitted to the ICU. He has blood clots on his lungs and a clot and a brain bleed. He received ECMO for 3 weeks and now he's still on the ventilator. A tracheostomy was scheduled, but he has lung collapsed yesterday and he can't hold steady oxygenation. I am really starting to get worried he isn't well enough for a CT scan. I am really scared. Please help me to understand what's happening and is there any hope? So thank you, Katrina, for writing in and for being a client. So Katrina, here is the thing. When your son has had some lung clots and some brain clots, so chances are that he would have been on heparin to thin his blood, because if there must have been a coagulation issue, because otherwise he wouldn't have had those blood clots in the first place. But you see, it all comes back to you don't know what you don't know, which is the biggest challenge for families in intensive care, that they don't know what they don't know, because intensive care is such a highly specialized area. And for any patients, let alone for a patient on ECMO, there are dozens, and I repeat that, dozens of things happening simultaneously that are all critically important. And that's why, if you haven't worked in intensive care for decades like I have, you wouldn't probably even know where to start. And the information that we often get from families is incomplete. And we can only make a complete assessment if we have all the relevant clinical information, which is why we need to speak to the doctors and nurses directly or review the medical records so that we can really help you. But anyway, to answer your question, Katrina, so one of the reasons that the tracheostomy was probably delayed as well is your son would have been on heparin. And heparin is a blood thinner, and when patients are on high doses of heparin, because of the blood clots, but also when patients are on ECMO, they are on heparin as well. Because the risk, when somebody's on ECMO, the risk that the ECMO tubes are clotting is very high. So therefore, a blood thinner needs to be put into the mix to stop the blood from clotting. So furthermore, with high PEEP, high oxygen requirements because of the ECMO, the risk for doing a tracheostomy is reasonably high as well. However, they should have been able to control that risk of high oxygenation levels with the ECMO, because in theory you could actually, in some situations, you could extubate a patient while they're on ECMO, because ECMO is doing all the work for the lungs and you could give the lungs a rest. Okay, so as far as I can see with the information that you've shared, Katrina, one of the reasons why your son cannot be having a tracheostomy yet is simply that he's on heparin and he's got high oxygen levels or high oxygen demands on him while he's on ECMO, and that is a combination that's not great. So the other issues that you've brought up is that he's still on the ventilator after 3 weeks. So the question is, why is he still on the ventilator after 3 weeks? Was ECMO not giving him enough time to let the lungs recover, right? Because that's the whole purpose often for VV ECMO, and VV ECMO is for lung failure, right? And that's the whole premise of it, to let the lungs recover so that you can then eventually get your son off the ventilator, and I'm not sure why it hasn't happened, and that's something we need to find out on our next phone call. So, you also mentioned that the tracheostomy has been scheduled but has been delayed. I did highlight that probably the combination of heparin as well as high oxygen requirements and high PEEP probably made it too risky for the ECMO, for the tracheostomy to be done. But on the other hand, the question is, with the tracheostomy being delayed, there's another risk, because what happens is when somebody is having a breathing tube instead of a tracheostomy, they need to be in an induced coma most of the time because the breathing tube is so uncomfortable, which means the tracheostomy hasn't been done, which means it's less likely for your son to breathe up because he still needs to be in an induced coma or in a sedative state because of the breathing tube being so uncomfortable in his mouth. So, it's not a good situation to be in for your son. So the tracheostomy should be scheduled as quickly as possible so he can be woken up, can get out of the induced coma, and can start to breathe by himself, and then being weaned off the ventilator slowly. Now, you're also mentioning that your son isn't stable enough to go for a CT scan. Now, most patients on ECMO, quite frankly, are very unstable. That's the reality, right? And a lot of patients on a CT scan are going for a CT scan. I have been transporting many patients myself on ECMO to a CT scan, and most patients on ECMO are very unstable, but nevertheless it's a case of making it safe for them, providing the resources that are necessary to take somebody for a CT scan, even if they're unstable and on ECMO. You are also saying that your son still has collapsed lungs, and that was another one of the reasons why your son didn't have the tracheostomy. Again, your son may still be in an induced coma and on sedation, and if he's not waking up and if he can't breathe up, the risk that he ends up with a ventilator associated pneumonia is pretty high. So the tracheostomy is inevitable. And how do they treat the blood clots? That's another question. How do they treat the blood clots? Mainly with the heparin that I mentioned before. And you also want to find out why he has those blood clots and why are they not going away. So you also mentioned that because of the lung collapse, he can't hold steady oxygenation, which I would assume his oxygen saturation drops quite frequently, which would also show up in his blood gases, probably with a low arterial oxygen levels as well as high CO2 levels. So the question is, why is that still happening after all this time on ECMO? And he's still not off the ventilator. So those are the type of questions you want to ask. Also, you want to look into if your son is still on any inotropes or vasopressors to see if he's on other life support besides the mechanical ventilation. Inotropes or vasopressors are given for mainly low blood pressure or for a weak heart, and you want to find out if that's the case as well. So you're still having a lot of unanswered questions to look into to find out what's exactly happening with your son. And again, you should be looking at arterial blood gases. You mentioned the chest x-ray. You also should be looking at the ventilator settings. What ventilator settings is he on? Is he anywhere close to come off the ventilator, for example, right? Other issues are, how likely is it that your son will need ECMO again, and again, that question you should be asking. So furthermore, you also want to find out when is the tracheostomy happening. When is the tracheostomy happening? Are there any other timelines around when your son will have the tracheostomy, because then he can come out of the induced coma, he can wake up. It's also less likely for him to have any inotropes, because sedation often reduces blood pressure. You also want to find out if the kidney function of your son is okay. A lot of patients that are on ECMO and in an induced coma for prolonged periods, sometimes they go into kidney failure. So those are all the things you may want to look at. So I hope that helps, Katrina. I know we've got a call scheduled in the next couple of days to find out, what we're going to do next, and whether we need to talk to the doctors again to get the outcomes that you will need, and that you will need for your son, and more importantly, that you really understand what is exactly happening while your son is in intensive care. So thanks for watching, and how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You will get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you will learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests, how to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind the scenes insight so that you know and understand what's really happening in intensive care, and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also have a look at our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership site intensivecaresupport.org for families of critically ill patients in intensive care. You can also call me, find phone numbers on the top of the website. Also, have a look at our ebook section, and you can also get one-on-one consulting and advocacy with me over the phone via Skype and via email by clicking on the relevant tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll talk to you next week.